think immunotherapy is one of a number of exciting advances. I think what we have to do is, as we approach a tumor as our opponent, we need to think about targeting the tumor and targeting the microenvironment. So we can find ways to target the tumor directly, or ways that we can enhance the immune system against the tumor. So certainly immunotherapy is one of a number of areas that are quite prominent right now for research, given recent results. But I think there are many other approaches as well. While we are identifying mutations in patients' tumors, realistically, a good 70% of patients or more might not have an actionable mutation for which we can give them an oral targeted agent. But many of these patients are benefiting from attacking the immune system, whether it be an antibody against PD-1 or PD-L1, these being very important regulators of the immune checkpoint. By that I mean that many tumors normally would be immunogenic and seen by the immune system, allowing T cells to kill them, but we now know that because tumors can make a protein known as PD-L1, they either make it or it's induced by the local environment. That protein actually acts as a cloaking device and keeps the tumor invisible to the immune system. So we now know that we can interact and break up that invisibility by using agents that target that pathway. And what we saw today in some of the sessions were examples of how when we use these antibodies, we're seeing very rapid and durable responses. For example, with an agent which I've worked with, MPDL, which is an antibody against PD-L1, we showed at ASCO and again today that agent can actually shrink lung cancer tumors objectively more than 20% of the time. But I would contest that even more patients benefit without true RECIST responses, and many of these responses are quite durable. So now we have the potential to try to think about how we're going to use these agents either alone or in combination with other targeted therapies or with other immunotherapies. It's a very exciting time to work in this field.